Welcome to Smile by Design, an inside look at the art and science of cosmetic implant dentistry. Brought to you by Palm Desert Center for Advanced Periodontics, Cosmetic, and Implant Dentistry. Our topic today is what you need to know about dental implants. If you have loose-fitting dentures or you have lost one or more teeth, then my guest, Dr. Ann Nicholas, the most renowned periodontist, has some valuable information to offer us. Tell us about your practice and what type of patients you see.
This year we are celebrating 20 years at the same location, and the type of patient we see at the practice are patients that lost all their teeth, denture wearers, patients that lost one or multiple teeth, patients that have periodontal disease and they're afraid to do something and they don't know what to do and what are their options. They have bad breath and they don't want to remove their teeth, and sometimes they wait too long till they lose all their bone. There are patients that need treatment for gum recession or gummy smile so that they have a beautiful smile.
In your center, you work together with Dr. Adam Keach. Tell us about your teamwork.
Our practice is unique because we have a team of specialists at the same location, and this way we can coordinate treatment much better for our patients, because this way a patient doesn't have to go from one office to the other office, and they don't like to do that. They want to stay in the same place, but at the same time we're able to provide for them the highest quality service at the same location. And I'm in charge of doing the surgical part for our patients, while Dr. Geach is in charge of making them a beautiful smile and making them look beautiful.
Dental implants changed over the years. What is new about it?
I'm very excited about the changes with dental implants in the dental field, because never before you're able to replace teeth with real teeth that look like real teeth, feel like real teeth, and chew like real teeth, which are dental implants. And what happened is that this way, by placing an implant, you preserve the bone in that location where the tooth is gone. So you don't make a one-tooth problem into a three-teeth problem and grind down 2 additional teeth to put a bridge, which would be harder to clean and would need to be replaced periodically every 5 to 10 years because of the bone shrinkage in the area where the tooth is missing. There are advanced grafting techniques that you can rebuild the bone in height and width. There are morphogenic proteins that are processed by the body.
Okay.
And that helps the healing, and the grafting makes everything much faster. So there's a lot of new advancement every few years. This is a rapid improvement in what you had done a year or two before. So you need to keep up with everything that's going on.
Sounds like there's been a lot of changes.
Right.
You say imaging has changed and it helps with downtime. How so?
We use CT scan for diagnostic and for planning of the surgery. So this way we can place the implants in more accurate position. The incision of the surgery are much smaller. The surgery takes a shorter time, and that makes a positive effect on healing, because you heal faster and there's less pain because the wound is open less and it's smaller. So the time of the surgery, instead of having a surgery that lasts 5-6 hours, can be 2-3 hours. So that's a big advancement, and most of our surgeries are CT scan guided surgeries.
You mentioned to me many times in the past that dental implants change people's lives. In what way?
That's an understatement, because many patients tell me that they wish they would have done it sooner, and they wish they would have had a trial period. If they would have been able to try it just for one day, there would have been no way that they would have chosen something else, or they would have gone back to what they had. And you see, for patients, for people that are missing one tooth or several teeth, they don't realize the dramatic change in that dental implants will make, and the change is immediate and very powerful. Because out of a sudden they can eat with confidence, they can chew whatever they want. They don't have to use the denture adhesive that doesn't taste good. It's amazing what those dental implants can do.
What are the different categories of your patients?
Well, there are patients that are missing one or several teeth, or there are patients that miss all their teeth, patients that have crowded teeth and they want to improve the look of their smile. And we basically treat everybody that has a more severe problem or a simple problem. We can take care of everybody that wants to make an improvement in the way they chew or the way they smile.
So the denture wearers benefit the most from dental implants?
Yes, because with dental implants you can secure now the denture to the underlying tissue so it doesn't move around. And when you don't have those implants, what happens is that the bone shrinks underneath, and then this is how dentures end up being relined. And I've seen many patients that after having dentures for 40 years, the part that was added, relined to the denture to compensate for the bone that was lost, it's sometimes 3 times as much in what's left.
Wow. Now you have models of the bone. Show us what's going on there.
Well, this is what's happening is that when you just lose the teeth, the bone is right here, the top. And over time, the bone goes from this level to this one till you get to this point in this situation where you cannot even have dental implants.
Oh, wow.
So bone shrinks due to lack of function. And the bone is maintained from the pressure that it's put, like when you have a tooth from chewing, the same thing with the implant. So the benefit of the implant is that it preserves the bone, while if the tooth is gone, the bone continues to shrink. Studies have showed that bone shrinks in the first year, about 20% in the first year.
You're kidding.
Yeah. So
That much?
That is the reason that patients that were wearing dentures for 40 years, they get to the point that they cannot, and they're in their 70s, let's say, and they cannot wear those dentures anymore because there is no retention. The whole bone is gone, melted away, shrunk, and the denture move around.
So earlier treatment is better.
Yes, correct, because you still have the bone to put those implants in so you can anchor the denture to the bone.
If dental implants are as good as you say, then why isn't everybody doing it?
Because there are many misconceptions about dental implants. Besides, they forgot what it is to have your own teeth and chew with your own teeth, because they have the bad experience immediately after the dentures were delivered. So they're unhappy the first week, then people have a nature to get adapted and living for the rest of their life with a disability, basically.
They just become immune to it, and they just learn to live with it and just move on through life with that.
And the other thing, as I said, there are misconceptions about dental implants there, that you need an implant for every tooth. So for example, if you have an edentulous jaw and initially there were 14 teeth, you don't need to put 14 implants to restore and have a fixed restoration. You can have 6 on the bottom, 8 on the top, and you can have something fixed that doesn't come out, and they feel and like their own teeth, they chew like their own teeth, and
So
they
have the
feel
luxury.
better than what they had before.
Okay, so they do have the luxury of not having to do the 14, but it could be the 6 or 8,
Right.
and everything could be achieved.
Then, when they believe that there are going to be so many implants, then they say, oh man, this is going to be expensive. I can afford to spend that kind of money. When you look at the cost and you compare over a period of 20 years, all the denture that you replace and reline, or bridges that you have to redo every 10 years because of the bone shrinkage and all that, dental implants, if it's done right at the beginning, when you still have the bone and you don't have to go through additional surgeries to rebuild the bone and go through the cost of all that, they're very cost effective. And as I said earlier, people don't realize what a dramatic change. And 3 months later, you have something that doesn't move around, that it's fixed. It's better like when you had your teeth 30, 40 years ago.
Well, it's good that you're getting this message out so people understand the pros and cons, and it sounds like everything is a win-win for them.
Right. The 2 biggest misconceptions is that, one, people are too old. They think they're too old to have implants. And I have people that are in mid-60s, and they come and tell me, at my age, spending all this money on myself.
Okay.
And there are many people that are retired that choose to live their golden years being miserable and putting up with those dentures that move around and using all this denture adhesive.
Well, again, I'm glad you're getting the word out, because I think if more people hear your message, the more I think they will contemplate and do your procedure. I think it's a
Right.
great procedure.
Right. Then the other thing that I hear people say many times is that they say, oh, implants is a very aggressive treatment.
Really?
It's more aggressive surgery. And it's totally incorrect, because when you have two virgin teeth that don't have a filling, don't have anything on them, no crowns.
Just
and
clean
you,
teeth.
Right, and you
Okay.
grind them down
Okay.
to put a bridge, it's more aggressive than because you're making a one-tooth problem into a three-teeth problem.
I see.
Okay?
Okay.
When you place an implant, they preserve the bone and you don't touch the adjacent teeth. And it's easier to clean. So it's like you got your tooth that you lost because of fracture or decay or whatever, you get that tooth back.
Okay, so there is the misconception of how other procedures are done and how yours truly is completed. And
Right, and because of those misconceptions, this is why they are not interested, because they think it's expensive. Then it's pain. It's gonna be painful. And it's not painful because they're asleep. Dental implants is the most successful surgery on human body.
See, I also think too, you touched on something a few moments ago about pain. I think people going to do something like this, I think that's the first thing that comes to mind with them. And I think if
Sounds
they get
painful.
Yes, it does.
Yeah.
It sounds very painful. So I think once you get them comfortable and understanding that that won't be an issue, I think that's half your battle right there.
Well, here's the thing. We treated hundreds of people. None of them would consider going back to what they had before.
Oh,
It's
fantastic.
amazing. So if somebody has doubts about that, about the pain, we can put them in contact with people that had this exact treatment done, and they can talk to them directly.
See, again, like we talked about earlier, that's the perfect way of doing it, the testimonial, as far as letting people understand what's going on. And I think that clears the air with a lot of issues. And I think, again, with you promoting and trying to answer the questions at hand here, I think it would be conducive for people to listen to this so they understand all of the procedure, what's entailed in the procedure, and how you go about it.
And what is nice with our team of specialists under one roof is that we can provide the best results, because when the bone shrinks, you need to compensate for that collapse
Okay.
and to make for the bites and the condyle. There's a lot of things to take in. So this is advanced reconstruction in terms of to accomplish the best result. And as a team, when I work with Dr.
Okay.
Geach, we have good communication and we can deliver fantastic results. It's going to last. They're not going to have an implant that's going to fail.
I see you brought some models. What do these represent?
This is a denture that it's anchored to implants, to 4 implants that
Okay.
get support both from the implants and the tissue below, and that's snap in, snap out. So it's pretty tight.
May I see
Check
it?
it out.
Thank you. Wow, that is tight. Yeah, very good. So this is a snap-in.
Yes. Then we have another model, and this model has 5 implants with a bar. So what this bar is doing is that as long as you have those 5 implants here in the front, you can have those wings. They're helpful in the area where I showed earlier on those models that the bone in the back is gone. So it stabilizes the denture. So this denture in this situation sits on the bar, and this bar prevents the movement to the left and the right, and also up and down, because if you didn't have those wings, then it will rock in the back.
Very interesting.
The more implants you add, the more stability you get, and you can make actually with 6 implants to 8 implants a fixed prosthesis that does not come out.
So everything is secured in there, and everything, no movement, everything sits perfectly flush, and you're good to go.
Yes, and then this is what people like, because it's psychological. When you have at night to take those teeth in and out and clean them, or when they're part of you, that they don't come out, then people feel better about themselves. They feel younger. They
Their whole attitude changes,
Yes.
is what you're saying. They just
Yeah.
feel more vibrant, everything seems to be
And
better.
those teeth feel to them, those fixed 6 implants secure the teeth in place, feel to the patients like they tell me better than their own teeth that they had before when they had teeth.
So you do have testimony about that, that they're saying it's better than what they've had.
Yes, definitely.
Fantastic.
And they say, if I knew then what I know now, man, I would have done it from the beginning a long time ago.
So it's just a matter of getting somebody in so you can explain the process so they can have an understanding of what it is. And a lot of these people then would have this done a lot sooner.
Right.
Excellent. Very good. So that all being said, what is your final message for denture wearers or people missing one or multiple teeth?
My message is for patients that wear dentures or
Okay.
are missing one or multiple teeth, or they don't like their smile and want to improve their smile. Don't hesitate. Take action, give us a call, come on in for a no-fee consultation and find out what your options are.
Thank you, Doctor.
My pleasure.
This was both educational and enlightening. Until next time.